Garlic is one of the best things that you can take for hypertension and heart by far, because it works on so many different levels. It's a fantastic supplement. You can just put it in all your foods. You can take it as a supplement, and there are lots of different variations, and they all show positive effects. And I want to sum it up very quickly. First of all, we know that hypertension is by far the biggest risk factor for a heart attack and stroke. So we're going to come back to that in a moment. But what we know is inflammation and oxidation. These two here are the cornerstones of all chronic illness. All chronic illness, diabetes through to cancers, through to heart attacks. So what we want to do is lower them. And garlic, first of all, lowers inflammation and lowers oxidation. You see, it works through so many mechanisms in reducing the risk of heart disease and heart attacks. So we've got the oxidation inflammation. It actually lowers calcification, which is the buildup of calcium on the plaque of the arteries, causing arterial stiffness. So we see in the studies that it lowers arterial stiffness, and long period studies that have been done for 12 months show that it actually helps decalcify the artery. So it helps pull some of the calcium off the arteries, which means you've got much more flexible arteries that it can push the blood around really happily and healthily. Then you've got it lowers the triglycerides. These are the nasty fats in the blood that are out of balance, and it lowers them. It's a blood thinner. So in other words, it keeps everything moving through those little tiny capillaries without any chances of blockages and so on. So it's a win-win-win situation. But the real winner is when it comes to hypertension. And there's no doubt about the benefits of garlic. Now, it may not give the highest results I've seen in terms of the review of 1,000 studies that I've been doing, but what it shows consistently. So one meta-analysis, so where they brought 20 good studies together, so they didn't just select them, they got the best 20 studies, and they found that garlic lowered your SBP, your systolic blood pressure, by 5 millimeters of mercury, 5 points, and diastolic blood pressure by 2.1. They did another one where where they got the people who were already hypertense and diabetic. So these people already were really at elevated risk, and it reduced your systolic blood pressure by 22 millimeters of mercury. Now that is huge, okay? But these people are already at risk. Now in these studies, these are averages. So they would have been given to people with low blood pressure and high blood pressure, and so they take the average. But all of the studies show for people with high blood pressure, it actually works extremely effectively. And it also works on the blood pressure that doesn't come down with the medication. And so what we see, garlic is just fantastic. But in what's called a Cochrane review, now a Cochrane review is the most important of the scientific medical studies, where they bring only the top studies. And they go through this really precise protocol of assessing them, the top studies, and they showed that garlic, either as aged garlic and or as a powder supplement and or as garlic like I've got in my hand, lowers blood pressure by 10 to 12 millimeters of mercury. So that's a huge drop. And then it lowers diastolic blood pressure by 6 to 9 millimeters of mercury. So the benefits in hypertension, and remember all these other benefits I've got listed on the board and from the other video that I just put up to do with your overall health, there is no excuse for not having a couple of cloves of garlic every single day, even try to fit it a little bit more in. And as I said, you can get it as a supplement. If you like this information, please touch the buttons on the side and share it with your friends.